Hi, I'm Dr. David Haase with the MaxWell Clinic, and have you ever been told your lab work looks normal, but you still don't feel well? That's really something we hear all the time. Today I'm going to walk you through why our advanced lab testing at MaxWell Clinic goes deeper and how it can provide some missing pieces that you need to truly understand your health. And just as importantly, how having a clinician by your side makes all the difference when deciding what to do next. So what is advanced lab testing? Well, this differs from the conventional lab work. Standard labs focus on diagnosing disease, detecting disease. Like for instance, hemoglobin A1C is, when I entered medicine, it was if you had a hemoglobin A1C, which measures your average blood sugar, and it was above 8, then you were clearly diabetic. And then that number came down to 7, and then it came down to 6.8 and 6.4, where it is right now. They keep moving the line, and if you're above the line, you have diabetes. If you're below the line, you don't have it. And that's what this kind of black or white view of laboratory information is really a standard approach. It's a disease-centered approach. We take a function-centered mindset, and we have a question in our mind about not just what do you have a disease or not, but what is your level of function? How ideal is your body functioning? Many of these specific condition detecting labs like cholesterol levels or glucose or liver function really are thinking about organ systems. Like you have to have things that are really going wrong for the red flag to be raised in a conventional lab. But advanced lab testing evaluates things that are working under the hood, like what is the health of the cell? How much inflammation is present in its many different flavors. There's many different flavors of inflammation. What's your nutrient status? Your metabolic markers, your hormone markers, to really assess and understand your overall body function. At MaxWell Clinic, we have one of the most extensive laboratory testing capabilities of any center in the world. We partner with over 50 specialized lab companies worldwide, giving us access to cutting-edge tests that many clinics don't offer. You know, from comprehensive genetic panels to microbiome assessments, mitochondrial evaluations, toxin assessments, advanced autoimmune diagnostics. All of these help us create a more complete, personalized health assessment. We really believe in test, don't guess. In functional medicine, labs aren't used just to confirm a diagnosis. They're used to see the patterns and the trends early so we can optimize your health and prevent problems before they start. Here are some examples of some advanced lab tests. Like, for instance, cellular health testing. We take an evaluation of how does your body bring in fuel, how does it mix it with oxygen, and what is the efficiency of converting that fuel into the energy of your cell, which is called ATP. All of your cells run on ATP. You may not hear about it, but you are creating and destroying and recreating your entire body weight of ATP every day. It's amazing how much work your cells are doing. And because they're so tiny, we don't give them a lot of credit, but they are the fundamental unit of life. And so understanding your cellular health is absolutely essential to being able to understand your body health. We have advanced testings to evaluate hormone patterns. It's been fascinating to me to watch little centers pop up, like here's your low T center, or there's a center that's going to fix your hormones. You know, because so many people have problems with hormone dysfunction. But the problem is if you just look at that hormone and you don't look at the context of the person, I mean, the treatment may actually cause more problems than the solution. So It's important not just to test the hormones, but to test the context, understand the person that one laboratory abnormality is present within. We also do testing of coagulation. How sticky is your blood? COVID has been terrible for increasing the stickiness of the blood. And we've seen elevations of things like D-dimer and fibrinogen. We have seen abnormalities in our glycocalyx testing to see how much the blood vessels and the coagulation ability of the blood has been affected. We do a lot of testing on different inflammatory markers, things like C-reactive protein, TGF-beta, complement C3A, complement C4A. There's so many different aspects of inflammation. Inflammation is really the fire that exists in your tissue because your immune system is defending you against something. It believes you're being invaded. It believes you're being injured, and it needs to destroy what's ever in front of it. As you can imagine, the inflammatory system needs to be tightly controlled, and just a little bit of excess activity can lead to a lot of downstream problems of body, of mind, and of life quality. The nutrient testing is important because if you are conditionally deficient in a nutrient, and this means that there are absolute nutritional deficiencies that every person, we could agree that a lab would show that every person is deficient at a certain level. What's even more interesting is the conditional deficiencies. You are genetically unique. All you have to do is look around. Do you look like anybody else in the world? Unless you have an identical twin. And even then, you're not exactly identical. But just like you don't look the same on the outside, you are not built the same on the inside. Your genetics are unique. You have a different expression pattern. You have a different number of cofactors needed for your enzyme dynamics. And why this is very important is that you don't know these things unless you go looking for them. Our lab tests really help us escape the one-size-fits-all approach. Lab data helps clinicians create a care plan tailored to what the body truly needs, whether it's changes to nutrition and lifestyle or targeted therapies. These results aren't just numbers. They're a roadmap we use to create a strategy to help you feel your best. It's very important to work with a qualified clinician. The more training a clinician has, a medical doctor, has a lot more understanding about the whole of your life experience, the whole of your challenges, and to put together more and more of the pattern. So we're very proud of the team that we have here working together to elevate these laboratory interpretation. Although these labs help us uncover what is happening, the real magic is what happens afterwards, the personalized approach that follows. When we identify early stage problems like insulin resistance, I have been evaluating insulin resistance for now over 25 years. Way before it was interesting, it used to be called Syndrome X. And we recognized that it was deeply tied towards depression, fatigue, coronary artery disease, cancer. And even now, a lot of clinicians don't spend much time. If your hemoglobin A1C is not above 6.4, nobody pays attention to you. But really, we want to get that hemoglobin A1C down closer to 4.8 to 5.2, ideally. And if we identify it, there's so much we can do about it. This is reversible with lifestyle and nutrition and behavioral aspects in the vast majority of cases, which brings you in control of your health. This is not us fixing you from the outside, but helping you to become aware of how do you claim your power and continue to create your health from the inside out. Thyroid abnormalities are all over the place. And these subclinical thyroid issues often don't appear on conventional patterns. I mentioned the different inflammatory tests. Different patterns lead us down a investigative path of what would be causing that inflammation. Is that inflammation coming from an autoimmune process, a food sensitivity, an infections, a toxin, an allergen? The same symptom and the same can mean very different causes in different individuals. So that's why laboratory diagnostics are incredibly important to give us that precision. We often catch issues that I would say are in the yellow flag stage, right? We don't want to wait till things get to the red flag that requires urgent intervention. It's so important to have a clinician guide you. Having access to labs is not enough without expert interpretation and guidance. Many people receive lab tests without getting a clear explanation of what they mean or really getting the value that they can deliver for you. A personalized approach means working with a clinician who takes the time to connect the data and your unique health story and helps you understand next steps. Your health is not static. It changes over time. You are a moving target. Having a care team that adjusts your plan based upon your life and lab results really helps you stay ahead of potential issues. So if you've ever felt like the usual lab work wasn't giving you the full picture, it's probably because it wasn't designed to, or that data is not being fully utilized to extract as much information as possible for you. Advanced testing helps us understand what's really happening in your body and gives us the insights we need to build a care plan just for you. So if you're ready to take control of your health, call the clinic and schedule a free MaxWell Care information call. I wish you well.